I'm really excited to introduce our next guest, Chad Redinbo. He is from New Leaf Hyperbarics, and he's going to talk to us today about hyperbaric oxygen chambers and really what is HBOT. We've heard about it, some of us know about it, and some of us are just like completely confused. So welcome, Chad. Thank you for being here.
Thanks for having me.
So before we get started about, what is hyperbarics, why are you so passionate about what you do to help our community?
My wife Kat and I, we have a daughter, and she's on the spectrum. We went through most of the things that most parents of spectrum children go through. I'm sure everybody's very familiar with that. And in our search for something to help her, I guess the way I think about it is she's driving down the road in a car at 60 miles an hour, and her windows are fogged. She doesn't understand that she's bumping into other cars or running red lights or things like that because her windows are fogged. So we were looking for something to unfog her windows. We put her into a mild hyperbaric chamber for about 35 treatments, and she made an amazing change. Her windows became unfogged. She began to look around and say, oh, those are other cars. Oh, those are the people. I need to take into account the world around me. She was able to interact better. We looked and tried to find that service around, and there really wasn't anything available, I guess. At the time there was, but it wasn't really accessible. We are business people, and so we decided to approach this world of medicine from a business standpoint and have the doctors do the doctoring and us do the businessing.
Well, you completely changed your entire career path because you were something else prior to this, correct?
I was a police officer, and then I went into international law enforcement and training and traveled around the world and dealt with bad guys everywhere, and it was a very exciting and interesting place to be, but you tend to lose your sense of good people. So you see the worst in most everybody, and so the opportunity to heal people, help people heal, help people get better, help their families get better, is a really strong and powerful calling, a really strong, powerful opportunity. We've been able to not only help kids, but help adults, help in a multitude of conditions, all with a really simple therapy.
Which is hyperbaric oxygen.
Hyperbaric oxygen.
So now that brings me to my next question. I'm thinking, some people that might know or remember Michael Jackson. We remember back in the day, you'd hear him, oh, he's sleeping in a hyperbaric oxygen, chamber. And it was like so like out there, right? It was like, what is this? So I remember years ago when I heard about hyperbaric, I was like, wait a second, is that like glass chambery thing that we saw in People magazine with Michael Jackson, years ago? And they're like, yes, it is, but we do it in this way, and there's not a glass chamber, and it's a little different. And so for people watching, they may or may not remember that story. It sounds so far out there, but again, as you said, it's so simple, really, the concept. So let's paint a picture first. What is a hyperbaric oxygen chamber?
It's really pretty simple. Hyperbaric means high pressure. And the way I look at it is the type of hyperbaric therapy that our clinics do and the folks that we work with do is it's called mild hyperbarics. It's 1.3 atmospheres, 4.2 pounds per square inch, which may or may not mean anything to you, but what it means is that it's just adding enough pressure to you to change your altitude from sea level to 11 feet lower than sea level. Sounds very little, but what it does is it allows us to put a whole bunch of extra oxygen into your bloodstream and move it further out from the blood vessels. So you get a perfusion of oxygen, and it moves in your body in a better way. Oxygen's super, super important in your body. Of course, every cell uses glucose in the presence of oxygen to make the energy for the cell. The difference is when it's not available, you get stuck in the inflammation cycle of wound healing and injuries, you get an inability to fill your battery up. So we all have a battery that we run off of every day. And good food, good water, clean air, rest, exercise, those kind of things fill up your battery. Most of us run at about here every day, hence coffee, and maybe a little alcohol to cool down at the end of the night. We all have our little things that we do. When you do hyperbarics, it fills your battery up and then puts another one on top, kind of thing.
It's like a spare battery.
Yeah, and your body says, oh, I've got all these extra resources. Maybe the first couple times it says we need to hang on to them, and we'll dole them out in those times where you're missing that much. After you do it several times, it says, wow, I've got the ability to make some changes. And the folks that we deal with tend to see more clarity, and their conditions, their issues progress, or they get better. They get better.
Yeah.
They feel better. It drops your inflammation like you took 12,000 milligrams of anti-inflammatory after an hour of treatment. It's pretty amazing. The thing I like most about it is it's lazy. You're just laying there, you breathe oxygen, you're under pressure, and you get better.
Well, let's explain what a hyperbaric oxygen chamber looks like for those that don't know.
So they run from a room-sized chamber where you have multiple people that sit in there, all the way down to a single portable chamber that's soft-sided, kind of like a tent. They're usually cylindrical, just because of the engineering of it, and more gas, more air. Like in our chambers, more air is added into the chamber than would normally be there. That creates pressure. You don't really feel the pressure so much. What you feel is your ears will pop like you're landing in an airplane. Not pop, equalize.
Yeah.
But they'll make that popping noise. And it's only for a few minutes, and then you stay at that same pressure. And even when you're breathing just room air, it's about 4 times more, 5 times more, depending on how your body works, than you normally use. So it's 21% oxygen in the air, and you maybe use 5% of it. That's why you can give CPR to somebody and actually give them oxygen, because you don't use it all when you breathe it in. Under pressure, we're able to take that extra oxygen and slide it into the plasma of your blood, and then move it 3.5 times further out from your blood vessels. And it gets the stuff that your cells need to the cells that need it.
And often in autism, for those that are watching, they might say, well, my child just has autism. Like, why would I need this? Well, because there's oftentimes with those individuals diagnosed with autism, they have other conditions that overlap or, that are also included. For example, my son has epilepsy, autism, celiac disease, mitochondrial disease characteristics, and the list goes on. So when people say, oh, poo-poo to that because, autism, whatever, we're not talking to your group. So if you guys are watching this and you're saying, because I don't want mean emails.
Yeah.
So if you're watching this and you're saying, oh, well, my child doesn't have any issues with this, that, or the other, then I think that's wonderful. I think that's great. But as we know in autism, there's many subgroups, right? And so the subgroup that we're talking about, those with individuals with autism, are those people that have a lot of other autoimmune conditions for some reason that are overlapping just the diagnosis of autism. And it seems as though there is a fairly large subgroup that are dealing with just, not just autism, but lots of other conditions. So for those families that are watching, this is why it's so important to learn about a treatment like this, because as you were talking about, we hear about inflammation all the time. And so, to have something where they go in, and is it about an hour, hour and a half typically?
It depends on what your doctor will prescribe and refer you for. A pretty typical treatment would be an hour, 60 minutes, or 90 minutes. And it depends what pressure they've prescribed for you. So one of the things that is very important to me is not only just the child, but the support for the child. There's all of us parents and support and siblings and everything that run ourselves ragged, really trying to support and take care of this person who needs us. And we tend to neglect ourselves as well. So this isn't just for autism.
Mhm.
This isn't just for that specific patient. It tends to help a lot of people with a lot of things. And like I said, just the battery issue of us,
Just
going day to
it
day,
seems as though it could be a regimen just to keep your health and wellness
100%.
another degree above. And we talk about that battery, the spare battery, but it's almost like that, that you think about the Energizer Bunny, and it's like, those commercials that we see of the bunny keep going. Well, many of us, especially those parents that have children with autism, our batteries are drained more so than I believe those parents of neurotypical children, because we are just constantly going from therapy to therapy, doctor's appointment to doctor's appointment, fighting schools with IEPs and trying to balance our work, schedules around all the other stuff that happens, between, here and there. And so, I've seen, I don't want to call them studies, but I guess surveys or something that talk about parents of children with autism are very similar with the stress levels of somebody with PTSD. And, I've said this in another interview, but I totally think this is so accurate. And yet our therapist, and like I said, I just said this in another interview, but I think it's, just in case you didn't see that one, you should hear it again. My therapist said the other day, she goes, the difference though, with somebody that's in, like, let's say the military that experiences PTSD, they went to boot camp ahead of time to be prepared to kind of go to war or battle or wherever, whatever happened to them. A family that gets a diagnosis with autism, there is no prep. Like, you have no idea this is going to happen, and all of a sudden you're thrown into, here's a pamphlet if you're lucky, your child has autism. Look at some speech, look at some therapy, and that's about it. Like, they don't really tell you all the fighting with the insurance companies and all the fighting with the school districts, and not only that, a lot of families, extended families, suddenly disappear because maybe they're just nervous, they don't know how to help, but suddenly you lose your group of friends. A lot of us do. Some of you guys don't, but majority of us, it feels, though I hear the same stories, we lose a big group of our friends. We lose a lot of our family members that don't want to really come around anymore. Some people actually lose their spouses, meaning they get divorced. We see a lot of single moms out there, and it's very difficult for them, and they're trying to balance work and like, as I said, the therapies and everything else. I can only imagine the kind of stress that they're having.
Well, my wife was home. I was out on patrol as a police officer, and my wife was home, and our daughter's in the backyard. We have two older children too, and they're all playing in the backyard. Big toy, 6-foot cedar fence. I mean, this place is like Fort Knox, man, because we need to make sure that what she's doing is definitely contained. And she's very sweetly eating a banana on the big toy, sitting eating a banana. And my wife turns, looks at something, looks back. She's not eating a banana anymore. She's not there. Looks out, not there. Looks in the yard, not there. Where is she? Can't find her. She had gone and pushed something up to the fence, climbed the 6-foot cedar fence I think she was 2 or 3, got over the fence, went down the driveway, down the road, went 600 feet down to the other kid's bus stop, into that neighborhood, just like at a full run. And so just the PTSD from that incident alone, we had to get monitoring things, put bells on her. She had no fear or understanding of what she was doing, where she was going at that point. When to equate that to my other life and profession and such, the folks that I deal with are protecting the country, doing the things that other people cannot do, prepared every day to take a life if they had to protect other people or themselves. There's a level of stress and dedication that, regardless of whether you're trying to find your child that's running at full speed amok somewhere, or protecting your country, there's a level of chemical that sits in an injury or
And you
stays
have
with
muscle
you.
memory too of it.
Yeah,
Yeah.
and or heaven forbid that you get in a roadside bombing incident and you have a traumatic brain injury, or while you're trying to find that child, you trip and fall and hurt yourself, and the chemicals get locked in there. Part of the great thing about hyperbarics is that it detoxifies you. So it goes in, it takes those chemicals out, and it drops that condition that you're dealing with, that fear that gets locked in there. There's a lot of our folks that will come in and they'll treat, and one of the things that we do, and I think most clinics do, is that when a child comes in, the parent goes in with them, and so you get a twofer. You know, the parent gets treated while the child gets treated, or if you are able to put a chamber in your house, what a wonderful thing, because then you have multiple family members that are going in the chamber, and you get that benefit as well. And a lot of times the parents don't understand the level of de-stress that comes, de-stress, not a word, but yeah, great. That comes from being able to get in the chamber and be in a contained environment, number one, spend quality time, number two. But most of the kids that get in the chamber react so calmly to it. It's like getting a hug. They calm, they focus. We had a lady who brought her 19-year-old autistic daughter in, and her daughter was too difficult for her to control day to day. She was in an adult care home, and she brought her in to treat in the chambers. She's very self-abusive, even in the waiting room. Just before she got into the chamber, the mom went in with her. And 10 minutes into it, very first treatment, we're watching, and the mom just starts to cry. And we're like, wow, what's happening? And she held up her hand, and her daughter was holding her hand. And she said, this is the first time in her whole life that she's ever held my hand.
Aww.
Yeah, what a powerful, amazing thing.
Right?
From sitting inside this wonderful creation. And the poor girl had never slept more than 4 hours at a time. She went home that night and slept for 12.
Her body was finally resting and restoring itself, like repairing itself.
Yeah. And then the mom said, I had the best sleep that night. And she was calm, and they got out and they were calm, and they spent quality time together. And it's a magnificent thing to be a part of when you can make that kind of an impact. And story after story after story.
Well, and what's nice about it too is I know when my son and I have gone into our hyperbaric, you can bring an iPad in often. I remember like trying to figure out, because he had limited language, how would I know if his ears were clicking or popping, like when you land from an airplane? So I would bring in like some water with a straw, like one of the crazy straws. And while it was pressurizing or depressurizing, I would have him drink from the straw, because he couldn't chew gum, and that such, because he doesn't know how, nor did I want gum everywhere. But I thought, what an easy thing. And then I remember bringing in things like, like the party blowers that you can blow. Like I would bring those in. So it would be like, take off, blast off, let's go. Woo! And like we would blow the blowers. And he thought it was like we were an astronaut, like going into space. And I remember with us at the time, because especially he was younger, I decorated the inside with Buzz Lightyear stuff. And I would pretend we were going into outer space, and I would make it really fun. Like it would be really exciting for him. And then that would be the time that he would only get special books. Like those books wouldn't be anywhere other than the chamber. And like even on the iPad, it was like only games for the chamber. So it would become something that he could look forward to.
That is a great way to do it.
Yeah.
And I think you're using the OxyHealth chamber that we use, the Viteris 320,
yes.
And it's big enough that you can sit up in. Most people can sit up in it, interact. You can lay down. You can lay down side by side, get some cuddle time. It's long enough. It's 8 feet long, so like one person can be at one end, one person can be at the other. It's the way that we use it. Also, we turn it on its side, and it has a metal frame in it. And the metal frame has 2 side pieces, and we put one side piece under the mattress, and then one side piece becomes the top piece. So we're able to hang iPads over the top and watch them, or whatever whatever thing that happens, you've got a way to drape Buzz Lightyear sheets over, make it a fun experience and deal with those kind of things. I find that the more that they understand what's happening, whether it's the child or the parent, the more they understand, the better. We're very heavy on education. We don't ever want somebody to come in and not understand the mechanism of it, or be able to progress the field. Because the more they understand, and this community, I mean, we're constantly studying, we're constantly learning, because how do we best take care of our children, and especially AHA, like pounding out the content and expanding people's minds. When you go into the chamber, whether it's in a clinical setting or in your home, and you see the changes that happen, being able to pass that knowledge on, pass that experience on, is key. It's key for other families and other kids to get the help, and key for the industry to continue to progress and move things forward and provide the tools and education and support that we can provide.
Now, how does somebody, so for example, I know you have a clinic, people can go visit your clinic, and so that's one option, is visiting a clinic such as yours. They can also rent a chamber as well, correct?
Yeah, sure.
And typically, do they do that for 30 days or 90 days, or is it just vary?
It depends. So you need a doctor's prescription to do it. And the doctor is going to determine what they think is best for you. And so they'll determine the number of days, the number of hours or minutes or per day that you're going to treat, and then the number of months or whatnot. What we normally see are 60 to 90-minute treatments, 5-6 days a week for maybe 40 hours. And so depending on how that is structured by the doctor, it can be 1 month, 2 months. But my own opinion is that I'm very evidence-based, and I want to see what happens. So I don't just like blindly follow. I don't think many of us do. And as wonderful as those doctors are, unless they get the feedback on it, they may not be able to adjust their protocols. So if we do 40 hours and we don't get the results that we're looking for, then maybe we'll do 80 or 60 or ask for a different adjustment to the number of hours, minutes, days, to find that right balance, because it's providing the resources for everybody that gets in the chamber that needs to happen.
What I love is that they can try it out as a rental, and then if they want, they can also purchase a chamber.
Yeah.
And for our family, that just made sense because he was using it so much. And with as we talked earlier, schedules are crazy. So sometimes it is hard to go to a clinic always at this particular time. And so, you might try that out first, and then maybe you'll try the rental at home, and then maybe you'll, figure out you might want to purchase one. How do people find out more about where you're located at?
So we're in Washington and Oregon, and basically just go on newleafworld.com. It used to be newleafhyperbarics.com. You can still type that in, but a lot of people have trouble spelling hyperbarics, and so I just made it easy, just New Leaf World.
Okay.
And as we open more clinics, then we'll get all over the world.
Newleafworld.com.
Calling OxyHealth directly is great. They're very good about sending you to a local clinic. And the way we do business, we don't want to be competitive. We want to be creative, and so we want the field to progress. So please just find a clinic, a local clinic, rent a chamber, buy a chamber. We rent chambers and sell chambers out of our clinics, and I think most clinics do. OxyHealth does as well, and then we do a lot of outreach and consulting and training and such as well. You can also call. We have a 800 number, so 800-689-1254, and we're happy to answer questions, and it'll guide you to a clinic that's near you if you're in our areas. If not, we're happy to help you find one.
And do you partner them or not partner, but I guess recommend certain doctors? Like, because I'm thinking if you're somewhere where you think, well, where would I even find a doctor that would give me this prescription? Do you recommend, hey, here's some doctors that you might want to consult with if they're interested?
Yeah, we're a member of the International Hyperbaric Association, which is a phenomenal group and phenomenal set of resources. AHA as well. All the resources that you all provide are key, I think, because we get further together than we do by ourselves. And so IHA is great because we may not have a relationship with a doctor in your area, but we have a lot of relationships with a lot of doctors, ones that understand, that have experience and can integrate other modalities with the hyperbarics, because hyperbarics is not the be-all, end-all.
Mm-hmm.
It is just a tool. It's a super effective and valuable tool, and one that we find as a central modality for how we do things, but it may not be the perfect thing. So the integration of other modalities, the open-mindedness of the doctors and understanding of the doctors, education of the doctors is key for us. So we have ones that we specifically work with, and I know that everybody does. So if we don't have one in your area, we can find one, help you find one, and so can OxyHealth as well.
I love that. And, and the doctor then can tell you if this was a good fit or not. So that's fantastic. Now, for those that are watching, what message do you want to leave them with?
There's hope. I mean, it's hard to keep that in mind, but there's hope. I look at everybody as a soul and a body, and the pathway that each particular soul is on. And my daughter is a very, very special creature. She was able to get help through the hyperbarics and the other love and support and effects of it. She created hope for us. And I think we just reached our 21,000th client, patient. And if it weren't for her, we never would have touched their lives. She's the whole reason we started our clinic, threw 2 hyperbaric chambers in that office and said, let's see what we can do. And so you never know what's going to come out of it, but you must maintain hope. And until you find the aha moment that fulfills that hope. So hang in there.
I love that message. Thank you so much for being here, Chad.
Thank you so much for having me.
And for all that are watching, until next time. Bye, guys.